These three women saved my life. But in this particular video, I want to talk about one of these women in particular. Her name is Jessica Powers. She's an oncologist at North Bay. And had it not been for her and the staff at North Bay Hospital, I would not be sitting here right now. For those of you who don't live in California or in the Bay Area, North Bay is a series of hospitals very similar to Kaiser in the Bay Area. I live in Sacramento and I wish they would build a North Bay here. But as far as I know, they are just like a Bay Area type of medical facility. So in 2018, I was diagnosed with a condition, an autoimmune disease called HLH. The pronunciation of HLH is hemophagocytic lymphohistiocytosis. It's a condition where your immune system gets confused and it tries to destroy itself. It's not your entire immune system, more specifically, this cell called macrophages. Think of the macrophages as kind of like, they're like the tanks of your immune system. They're large cells that consume and destroy microorganisms and things like that in your body. But when macrophages get confused, they start to attack other cells, and that can lead to you becoming very, very sick. And how HLH is typically dealt with is with chemotherapy. And like, I was on a litany of like chemo drugs. Antivirals, immunosuppressants. I was on like a bunch of drugs. And you have to go through a scheduled amount of treatments, just like somebody would if they get diagnosed with cancer. They give you X amount of days that you have to do your chemo treatments, and then after that allotment of time is done, they reevaluate you to see if the HLH is gone. So how they find out this is that there's certain, when they draw your blood to determine whether or not you have HLH, there's certain markers that that they're looking for. And when they see that these certain markers in your blood are abnormal, that's how they can determine whether or not you have HLH. Now, HLH is still a very anomalous thing in the world of medicine. Nobody knows where it came from. Nobody knows how it happens. The only thing they know is how to treat it. So HLH is considered a child disease. Usually children or adolescent teens, they get HLH. It usually doesn't happen to adults, but I was well into my 30s when this happened to me. There's theories that HLH may be hereditary. Possibly you can catch it somehow. Like I said, nobody really knows. And it's not just some ha-ha illness either. Like, if left unchecked, HLH could kill you. Like, before I went to the hospital, I was sick for 3 days, and I was gradually getting sicker. Had I ignored that, I easily would have died. So when I say that this woman, Jessica Powers, saved my life, that's exactly what I mean, right? So on the 4th day, I wasn't getting any better. I had to go to the hospital. I couldn't take it anymore. So I climbed in my car. I drove to the hospital. They admitted me. They asked me like a litany of questions. Did I have HIV? Did I have AIDS? Was it this thing? Was it that thing? Was it this? Nobody could figure out what was wrong with me. But as these questions are going on, I'm gradually getting sicker and sicker. And I'm feeling worse and worse. till they consulted oncology. And Dr. Powers was the doctor on call that day. And she asked for the results back of the blood. She asked for all the tests they ran. She told them to run this particular test. And she ran the blood work and said that based off of like the markers that I'm seeing in his blood, maybe it's this. And sure enough, that's what it was. It was HLH. So they started me on chemo, emergency chemo, immediately. I was in the hospital for 30 days doing chemo. And when I got out, I had to go to a cancer center, North Bay Cancer Center. And I had to do chemo, which it felt like the chemo treatments went on forever. And we're not talking about like they just hooked me up for 20, 30 minutes. Like I was on the machine for like 4 hours, 5 hours, 4 hours for just the chemo. And if they checked my blood, because after a chemo treatment, they got to check your blood to make sure that your blood levels aren't low. If they are, then you have to get a blood transfusion. And that's like an hour, maybe an hour and a half. So you're talking about like a 5 hour, 5.5 hour treatment right there. Then you gotta drive home. So needless to say, like I felt terrible. Like terrible is not even the proper word to describe how I felt. And the crazy thing is that it didn't feel like anything. Like when I initially got sick, it felt like I just had a cold. That's what I thought it was. I was NyQuiling myself to death trying to get better so I could go to work. But on like the third day, I realized just something inside me told me that this is not normal. This is not like a normal sickness. Something is very wrong with you, and you need to get help immediately. And so that's what I did. Over the course of my life, I've had a lot of doctors. And I gotta say that Dr. Powers is one of very few doctors that I've had that, like, I will sing her praises forever. I still see Dr. Powers to this day because there's always a possibility that the HLH could return. I guess you could use the word remission to describe what I'm in right now, but nobody knows how it happened. One day it just happened. Dr. Powers is one of the best doctors I've ever had. And I would recommend her to any and everyone.